So today we're going to be doing some mole removal with the Soniquence 4.0 megahertz radio wave system, and this is the pin electrode which we use on this system. And over the years I have probably done 10,000 of these moles, I think, and radio wave surgery, in my opinion and in my experience, is the most scarless way to do this. So what we usually set this around, we start around 12 watts, and what you want to do is when you activate the system, you want to be able to melt this down with the least amount of energy that you can, and try not to have it spark. If it overheats, you're not going to get as nice of a job because it's going to go deeper with lateral thermal damage. So we do this on pure cutting, and we just kind of go in a circular area there. And it's okay if you get a little bit of conduction sparking. That's not a problem. I think this is a perfect setting, and I can tell that by the way everything's coming off. Wipe it, okay. And if you have a little bit of bleeding, we use the bottom button here, which is the hemostasis, blot that, and we just gently tap that, and that will prevent any bleeding. And we're going to move around here now and just do this. This is a smaller one, and it just takes on those just a little bit, and we're going to go to the bridge of the nose here, and we're literally just taking layers off, almost like you're painting with a paintbrush. And I'm wearing loops, and if you're just starting and never done this, you want to go to the base of the lesion, and if you're experienced, you can go a little bit deeper. And here now, and you notice the blanching. We've injected all of these with 1/10 of a ml of local anesthesia. On the very superficial ones, you might be able to use topical anesthesia. And if you're going to do this, you have to understand and recognize any type of lesion that may be represent a basal cell, a squamous cell, any type of lesion that could be serious. And so many of our patients have seen their dermatologist. Actually, that's where we get a lot of referrals from. Let's wipe that. And if you're ever in doubt, you do a shave biopsy. And I can't tell you how many hundreds of these I have done over the decades, where a patient went to a plastic surgeon or dermatologist, and they wanted their moles removed, and they were told that the scar would be worse than the mole or the wart, and that's simply not true. So we get a little bit of pinpoint bleeding here, so we're going to go ahead and use the pure hemo. So what we tell the patients is to keep Vaseline or Neosporin on these, and that in a week they'll be smooth and pink, and then they can wear makeup. And generally they just heal extremely well. And what I do is, after the treatment, I take a couple minutes and let things dry out a little bit, and sometimes you'll see a little raised area that you go back and touch up. So there's 1, 2, 3, 4, 5, 6 moles, and as many minutes. And we'll go ahead and coat these with a little Vaseline or Neosporin, and just have the patient be careful in terms of using a towel, and just they can wash them with their fingers, and just regular whatever they use to shower with. And in a week she'll be in makeup. They will be pink for a while. This patient's very light complected, so she'll and I tell people they could be pink for months, but that's really rare. Almost always by 6 to 8 weeks, you can't even tell where the mole was on your average treatment. I'm Dr. Joe Niamtu, lovethatface.com.